46-year-old male patient, Jacob, presents to the emergency unit with severe abdominal pains, nausea, vomiting, and also he had fever. He has tried over-the-counter medication with no relief, and the symptoms have been going on for about a week. What could this be? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Abdominal pain is very common in the emergency unit. Sometimes it can be minor. However, in some cases, it can be clinically significant. Let us zoom closer into Jacob's case and dissect every aspect of it. Jacob's family was there with us in the emergency unit, and they have added that Jacob also had abdominal distension, fever, and bloody stools. When we examined Jacob, his blood pressure was very low, meaning that he was hypotensive. It was 80/45 with a heart rate of 130 beats per minute. This was fast. And the temperature was 39 degrees Celsius. On palpation of the abdomen, it was soft with very mild generalized tenderness. However, in cases whereby a patient presents late, the abdomen could be very hard or rigid to palpation with severe tenderness and also with guarding, and this we call peritonitis. In some cases, there could be absent bowel sounds. So if a patient comes to the emergency unit with this kind of pain, abdominal pain, which has been going on for about a week, what investigations would we look at? We've done bloods, infection markers, inflammation markers, and we also looked at kidney function tests. We also did liver function tests and amylase. We also did some imaging studies like abdominal x-rays. You may also choose to do an ultrasound of the abdomen. But for Jacob in particular, we took him for a CT scan of the abdomen. And to be more precise, it was a CT angiogram. And what did we find? Mesenteric infarction. And this is a life-threatening condition whereby a blood flow to the intestines is completely blocked. This would result in ischemia and even sometimes necrosis of the bowel. It is often missed because the symptoms in most cases are vague. However, if it's not treated promptly, it has a high mortality rate. This condition can result from arterial embolism. And what is this? This is when a clot moves from one vessel to the one that supplies the intestines and it blocks it. Or it could result from non-occlusive ischemia and sometimes venous thrombosis. How do we then manage these patients? When they come into the emergency unit, we need to give them intravenous fluids together with antibiotics and analgesia as soon as possible. We may even have to start anticoagulation if there's any clot formation. We need to have a surgical consult as soon as possible. They may go for endovascular intervention or sometimes even resection of the necrotic bowel. Post-operatively, we need to support them nutritionally. What could possibly go wrong, or what could be the complications if this condition is not treated early? The patient could have bowel necrosis, peritonitis, sepsis, multi-organ failure, and even death. Therefore, what was the outcome for Jacob? He was diagnosed with acute mesenteric infarction. He was taken by the surgeons to theater, whereby they had to resect his bowel because it was necrotic already. He was therefore taken to ICU, where he recovered very well. He survived because he presented to the emergency unit quite early. In conclusion, Mesenteric infarction is a rare condition but can be deadly. Early recognition of the signs and symptoms of this condition and surgical intervention as soon as possible can save a patient's life. And thank you for watching. See you in the next case.